Hi, thank you for giving us a chance to present foundations from HealthLevel. Allow me to give you a brief context as to why HealthLevel exists, who we are, and some examples from our customer sites and product demonstration. What we find is every industry is being transformed using data and information. We want to do better, we want to do more with less, we want to have healthy margins, and most important, we want to improve the quality. And that is where the genesis of our company, HealthLevel, and the name comes from. HealthLevel wants to level the playing field so that we can use data very similarly to how Amazon, Goldman Sachs, or Google, or Netflix, just as illustrative examples, use data to run their business. This is so important in our survival and growth and improved patient care that if we don't, we are going to end up like this. But bringing us back to our real life and our context. Every administrator, physician, staff, manager, supervisor has at some point in time in their life felt like this person in the picture. What we call colorful problems are also gems of insight. The consistent theme across all of these problems is a better way to measure and manage. And one must be wondering, in light of so many different data analytics tools and powerful platforms and beautiful visualizations that are offered from various different tools like Cognos, Business Objects, Tableau, ClickCheck, Spotfire, and so many other different tools that I can't even enumerate, you cannot swing a stick without hitting some data analytics tool out there. Where did we come from? Why do we exist? Allow me to give you the examples of our genesis and growth from the eyes of a customer. The Veterans Healthcare National Teleradiology Program was formed about 10 to 11 years back as a program within the Veterans Healthcare system to provide similar to radiology group services within the VA system. But the beauty of the program and the wisdom of their leadership was they were not, the VA system, VA medical centers were not mandated to use the NTP services. Fast forward 10 years, this program is so successful in light of competition and winning business away from competition that they have grown from 10 to 15 medical centers when we were working with them, when we started working with them, to over 100 medical centers. And we are not their PACS, we are not their dictation system, we are not their workflow system, but we are the glue, we are everything that brings it together. We have found our identity from the eyes of our customers. We are not just a data analytics engine or a reporting toolkit. We have been recognized as the data-driven business management platform. We today serve 3 markets: radiology. In cardiology, our customers are recognizing us as the gold standard for cardiology informatics. And we have also entered the pay-provider market, the payer-provider market, the managed care systems and ACs and other areas. What is the evidence of what we have done? Starting to work with the VA NTP, they have not only grown their revenue over the past 6 years, but also it is a phenomenal efficiency and margin improvement story. But as always, we count our beans, but it is the patient care quality. And their quality, transparency, and collaboration is so good that they have a waiting list of customers. Again, to reiterate, there is not a single VA medical center that is forced to use the NTP. In fact, their pricing is probably a little higher without going into the details. Even so, VA medical centers are waiting in line to take services from NTP. Let's take a look at what technology gifts, or what is it that we do for NTP? Why do they call us the data-driven business management platform? When we started doing the research as to what should we build and how should foundations work, what are the problems in data analytics, the number one theme that came up was, even if there's data, the insight is not meaningful to the end user. So what we set out to build was an extremely easy to use, end user focused system. If you can use Google, LinkedIn, Facebook, you should be able to use Foundations because it is a business tool. The kind of data that we provide is real-time and historic, clinical, financial, and operational insight. This is important to engage the masses of users of different roles and different types, what we call the purpose-oriented access or purpose-oriented portal. When you think about answering questions, when you get an answer, you typically want to ask a new question. And for the appropriately privileged user, we offer the discovery engine so that you can answer new questions easily. And Foundations, true to its name, is a true platform. We are the biggest consumers of our own API, and we build little tools on top of our platform to help our customers solve certain problems and fill certain gaps. This is the reason, these are some of the reasons why Foundations is called the data-driven business management platform. Allow me to give you a brief demonstration. I'm going to pull up my browser over here, and I have a login page for Foundations. Sign into your Foundations account. All you need is access privileges, email address, password. And allow me to give you a very quick orientation to the user interface. When you log in, you see a concept of workspaces. Now, I am an administrator, so I see 31 different workspaces, but most users will have 3, 4, 5 at the very most, whatever is their role and their intent of providing them insight and information. Let's say you are a financial manager that wants to look at financial targets, all right? But you can also have personalized performance for radiologists to engage with the system, personalized information for department managers. You can make this available to your customers for transparency on how you are serving them and various different applications. Let's go into financial targets as an example. Think of it as when you open up a newspaper, you look at the headlines first, and then you look at the detailed news stories. The headlines over here are, for example, last month's summary, AR aging greater than 60 days, 29 million. Your target is 10 million. You're way in the red. You can set up measures and targets, stay close to aim to exceed or use a global preset. If you have a large number of users, they can have global preset targets. And you can set up rubrics, and when the range value changes, you can set up a range name or keep yourself informed through alerts. When you look at the headlines, then you can look at the detailed news stories. For example, your revenue by the clinic, or in your case, it could be imaging centers. There's technical charges and professional charges by the location. There is a physician RVU in terms of productivity and various different measures over there. By their physician's name, this is all de-identified information. Charges collected by the payer, various different payers and what you're collecting from each of them. And here is an example of AR aging by the department. For example, you have 3 departments that have an AR aging greater than 90 days over here, it looks like. And that's urgent care, coronary care, and emergency. One of the things that comes to mind when you see reports, charts, graphs is how do you trust the data? What is the context? Well, anywhere that you see a line, point, number, bar chart, in one click, you can go to the detailed line items. This is what we call a patient drill view. There are other views called the case level drill view, or financial drill view, or workflow drill view, so on and so forth. You can see that in your case, you could be collecting data from multiple different locations, and you can get a longitudinal patient record built up. Patient medical record number, order, clinical information, vital signs, financials, and so on and so forth. But this is just an illustrative example of what we call the progressive disclosure, going from high-level workspaces to summaries, detailed charts and graphs, to drill views, and all the way down to a patient's medical record for whatever data we have collected for you. We'll reset the zoom over here. You must be wondering, how do we create these reports, charts, graphs? So allow me to change over to the demonstration for what we call the power user or the discovery engine. I'm going to add a new workspace. I'm going to call it demo recording. And it's a demo. And I want to add a new report. I'm going to start from a blank slate over here. I can copy from an existing report, which is a list of various different reports over here from the library, or I can start a new report, which is what I'm going to do. Now, when you're trying to build a report, what you are trying to do is paint a business picture. To paint a business picture, you need a palette of colors. For example, over here, I have a palette of colors called the patients, the order information, duration. These are called the measures palette. order to procedure, which can help you understand the access and lead times, wait duration, how long are the patients waiting in the waiting area, report turnaround times, charges posted delay, so on and so forth. You have RVUs, CPT codes, image count, radiation exposure, and internal auditing and system performance analytics as well. What I want to do is, let's say I want to count the number of procedures, and I want to do this for a date of service. Let's say I want to look for all of the finalized reports that has a valid date. And let's just see how much data do I have. I have 1.3 million procedures in my system right now for my demo set. I want to understand who are the physicians that are signing these reports. And I can say signing radiologist name. I can do de-identified comparison or top 10, bottom 10. But right now I just want all the names. Clearly you can see from the names that these are all de-identified names and random names over here. I want to see this information as a bar chart. And I want to overlay this with a measure for, let's say, RVUs, or average turnaround time. Average turnaround time. I can do medians, I can do standard deviations, and so on and so forth. I'm digressing over here. But the point is, I can move this around, and you can see that I can go from tables to charts to various different ways of visualization. This is a simple illustrative example without trying to create a product training demo of the power of the discovery engine to answer questions very quickly. You can go beyond this by using business parameters for reference values, cascading measures, and cascading reports, and so many other things. Allow me to hold off over here for a moment and go back to our PowerPoint to begin wrapping up this demonstration. What we started our foundations as the way to make information and insight available to end users has turned into a data-driven business management platform that is so powerful that we are probably the very unique and only vendors, manufacturers of software that offer you a very powerful system that is largely automated in terms of collecting data in real time, as well as the software development, the technology operations methodology. For example, Foundations has been in continuous operations at the VA NTP for over almost 7 years now. And we have not had any significant downtime, including downtime for upgrades. We upgrade our customer systems on-premise or in the cloud within 3 seconds. This is very important because you cannot have business interruptions if we are going to be a data-driven business management platform. And this is the level of managed services that we want to offer you to make your life extremely easy and simple so that you can use your resources to invest in areas of technology and information systems that offer better quality, higher quality, as well as better margin and various other things, such as a PACS implementation or a workflow engine or other various different tools and capabilities. Going into our competition can be considered to be various different data analytics tools and vendors and so on and so forth. But what we have found, our best customers are the ones that have some experience with data analytics tools and realize that they need more than that. Because as they need to answer more questions, they realize that the cost and the effort involved in answering these questions is quite high. The second area is, I do not believe that there are very many tools out there that offer unlimited user access and have a business model that is aligned with your business, such as measuring, counting, and a business model that counts the number of procedures or the number of visits, or so on and so forth. Going forward, our biggest competition actually is status quo. And when you think about Star Wars, it's Obi-Wan Kenobi going over to Luke Skywalker and saying, let's go to Alderaan and save Princess Leia. What was Luke Skywalker's response? Oh, no, I got way too much work to do. I got to go back to the farm. And this is where we want to educate our customers and provide information to imagine what can be done. And we welcome you to speak with our customers as well. Thank you so much for your time. And it's a pleasure to record this demonstration for you. And we look forward to working with you again. Thank you.